What ways can we be mindful of the ones who might be slipping through the cracks, per se, just because they don't know, maybe they aren't able to identify those stressors?
I think that's a really important question because sometimes it isn't always apparent when kids are struggling, and sometimes they don't always have the language to be able to talk about it in ways that we might as adults. And so I often tell parents that, when you're wondering about how your child is doing, you pay attention to any changes that are happening in their daily functioning. For example, with teenagers, are they disengaging from talking to you, talking to friends? Are they not enjoying the things that they used to enjoy? Sleeping irregularly, having difficulty falling asleep, waking up? Is their eating changing? These are just like easy everyday ways to kind of tap into whether you're seeing that your child might be struggling or that they might feel stressed. The other thing is when there are changes in our lives, and these don't have to be traumatic changes, we all go through an adjustment period. And so if mom or dad loses a job, starts a new job, if you move, if you have to change schools, if a friend moves away, these are all things that sometimes kids might experience in different ways and have different feelings and thoughts that can be stressful. And so if you know that those things are happening, you can check in with them. And checking in doesn't always look like, how are you feeling? Because you not necessarily get the answer that you're looking for. But if you ask things like, what's something funny that happened today at school? Sort of model for them how you have a conversation about how you feel, or what's happening in your life. And that is the way that you can try to get some of that from your kids if it isn't always apparent to you that something is going on.
So as a parent of a 5-year-old, and me also speaking to other parents who have like younger children as well, we don't necessarily have access to mental health services due to there not being like a direct diagnosis to like a tragic event or something along those lines. So I was wondering, what could be changed or possibly looked at differently here, just so that younger children also have the opportunity to speak with therapists as well?
I think part of your question is something that those of us who have young people in our care, we're all wondering, how we can provide them with as much support as possible. So I know that's a common, wondering of parents. And the truth of the matter is you don't have to have experienced a traumatic event per se, and you really don't necessarily have to have something that's going wrong to seek out the support of a mental health professional. You can find a therapist if you happen to have insurance. You can get a list from your insurance company that lists providers that are providing psychotherapy or behavioral therapy for your child. And you can sort of call around just like you would a pediatrician to find a therapist. And seek out the support of professionals at schools who can give you strategies or tips or tools while you're trying to find a therapist for your child. I think the biggest idea is you don't have to be, severely ill to get the support of talking to someone. And that's something that even little people can benefit from, particularly in these COVID times when school is a place where kids learn social and emotional coping. And because there's so much disruption with school, having someone else for them to talk to can be really helpful to seek out. Psychologytoday.com can often be like a starting point as well to find a therapist. Many therapists will take Medicaid. Some therapists work pro bono. Some therapists will use a sliding scale and try to work with you if you're using cash to pay. Here at Wayne Pediatrics, we, take a number of insurances. And so there are ways that you can get support for a 5-year-old, even if trauma isn't, a primary reason why you're seeking out that therapy.
Thank you for addressing that. I think that there's like a little miscommunication there that maybe a lot of us parents weren't aware of. So I appreciate that. The next question that I had was that, are there measurable ways that we as parents can gauge the effectiveness of the strategies that we've put in place for our children, just to, maybe mitigate some of the stress that they might be feeling? And also, like, when should we consider switching those strategies or tools that we have put in place?
Yeah, this is such a great idea for parents to consider because, as parents, as moms, as dads, we are all things to our children. One of the easiest ways, I think, is if you think about if you're doing something, how can you measure it? And then how can you sort of watch over time if that thing changes? So for example, if you are trying to reduce a negative behavior like tantrums, and you pick a strategy like ignoring it, way to jot down if the tantrums either aren't happening as frequently or if they don't last as long. That's a measurable way for you to know if what you're doing is working. And this can often be something that you can talk with your pediatrician about or the therapist about, working with you on how you're implementing whatever you're doing and seeing if it's working. Teachers are great resources as well. School counselors, school professionals can help you try out how to understand if what you're doing is making a difference. But the biggest thing is, and I often say this to parents because parents will say, well, I've tried this, I've tried that, and it hasn't worked. And so, it's when we start to ask more questions, well, how long have you tried it? Sometimes it takes a while to take effect. And how do you know if it hasn't worked? And if you're not sort of keeping track of it in some way, then you won't know.
One of the questions that I have for you today is what access to professional support can folks without health insurance expect to receive, and is it quality?
Well, in Michigan, if your child doesn't have health insurance, it is very easy through my child to get health insurance for them. And I would say that would be a great way to begin to access the services and supports that are out there. If you have Medicaid, there are resources available. Sometimes these days there are wait lists both with Medicaid and private insurance to gain access to that. And then for adults, there are also ways to try to get some sort of health coverage. That said, many therapists will, again, use cash pay. They might work with you on a sliding scale based upon what you think that you can pay. And that takes sort of making some cold calls and seeing, who's taking certain kinds of payment that might be accessible or available to you. If you can start with a list of potential providers and come up with a few questions that you have to try to navigate that's a way to kind of approach figuring out how to find someone if you don't have help.
What is some advice that you would give to parents who might be afraid to seek mental health treatment for their children because maybe they've had past experiences with social workers or other authorities that they feel that if their children share a certain thing, they might run the risk of losing them?
Well, I think that's a very real fear. And I think it's important to share your reservations and concerns with the professional so that they can talk about what their approach is and what they might be required to report, or sort of how those things work. I think that a lot of parents rely on like word of mouth and professionals that they feel comfortable with. And other than that, I think that whatever your concerns, like you're buying a car, you can own that process and talk about, listen, this has been my experience. This hasn't worked. This is why I'm reserved. What do you think about that? And you can actually interview the therapist in order to get that comfortability that you're looking for, to see how do they work? What do they do? How are they going to talk to me?
So my question for you is, which mental disorders are often seen in children?
Well, depression and anxiety is a very frequent diagnosis for many people. There's a high prevalence both in children and adults. So what that looks like is, if you out a lot and, not doing the things that you're used to doing, not really finding pleasure, your sleep is off, your eating is off. It's about you're hurting yourself. If you're really worried or agitated, often in children, being really agitated and irritable can mean a lot of different things. It's not just that the child is bad. A lot of times children, when they're struggling, it comes out in those ways because they don't have the language to otherwise communicate it. So I think that thinking about, how they're functioning is a starting point. But those are some of the very kinds of diagnoses that we begin.
What are some ways that parents can support development of positive social skills with minimal peer-to-peer interactions?
The conversations you have with your children are the primary way that we build communication and language. And so even in the absence of being with their peers, the more you can talk with them, talking about your day, talking about your wonderings, talking about, a TV show and what a character does. These are all ways that we develop social skills. And when we're frustrated and how we're dealing with it and feeling it and experiencing it, those are all ways that we can model for them how to interact with other human beings. So even if you don't have another child available at school or a friend, the family, even you as a parent, you can be that coach for social skills that they need.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.